Welcome, everyone. Thank you so much for joining us today for this community conversation about mental health and stress and the impact on our health and well-being. I am honored to be here today. My name is, or this evening, I should say, my name is Carla Mulhern. I am the Executive Director here for the Southern New England market for the American Heart Association. We are so grateful to Neighborhood Health Plan of Rhode Island for making this possible this evening. We have a great topic to cover. And before we jump into things, I would like to welcome Beth Lobdell, Senior Director of Programs with Connecting for Children and Families, to say a few words.
Thank you, Carla. I just wanted to welcome everyone on behalf of Connecting for Children and Families. We're happy to be working with the American Heart Association and Neighborhood Health Plan of Rhode Island to pull this together to host this community conversation. We've heard a lot about mental health and stress lately, especially with the pandemic still in our midst. So this conversation is timely and on point. I look forward to learning along with you tonight. Thanks so much.
Y entonces queremos decir, Carla dice, bienvenidos a todos. Muchas gracias por acompañarnos esta noche en esta conversación comunitaria sobre la salud mental y estrés y su impacto en nuestra salud y bienestar. Estamos muy agradecidos a Neighborhood Health Plan of Rhode Island por hacer esto posible. Tenemos un gran tema que cubrir esta noche y antes de comenzar, me gustaría dar la bienvenida a Beth Lobdell, directora mayor de programas de Connecting for Children and Families, para compartir algunas palabras. Y entonces Beth dice que, gracias a ustedes y entonces quiere escuchar mucho sobre mental health, estrés y salud mental. Y entonces, porque este es una tópica muy importante. So, yeah. So then, Carla, you're on again.
Thank you. Thank you so much, Beth. I would now like to introduce Lauren Chang, who is a licensed independent clinical social worker who works with patients in cardiac rehab and in their private practice. Welcome, Lauren.
Thank you. Thank you.
So nice to have you.
Really an honor to be here.
Bueno, y entonces me gustaría presentar a Lauren Chang, trabajadora de clínica social independiente con licencia que trabaja con pacientes en rehabilitación cardíaca y en la práctica privada. Bienvenido, Lauren.
Thank you so much, Lauren, and we are so thrilled again to have you here and can't wait to dive into this topic, something that I am very much interested in. It's part of, especially with COVID now, part of our lives. Okay, so let's get started with our first question. Can you give us a brief description of mental health and stress and how they are linked together?
Okay.
So, ¿se puede darnos una breve descripción de la salud mental y el estrés y cómo se relacionan?
Stress is the feeling of being overwhelmed or unable to cope with emotional pressures. When stress is prolonged, the risk to our mental and physical health increases. Mental health issues include anxiety, depression, and substance abuse, sleep issues, physical pain, which is often experienced as muscle tension. Stress also leads to inflammatory responses in the body, and we can see that in skin. I'll use skin as an example. So stress can manifest itself as rashes, itchy rashes, or acne. It also decreases our immune system, and we can get frequent colds and flus. It can cause irregular periods for women and really, mess with their menstrual cycles. The other thing to really keep in mind is that suicidal ideation can occur. And there are two kinds. There's passive ideation and then an active ideation. And when it's passive, people may be thinking about leaving this world, but they likely don't have an active plan. When it is active, there is often a plan, and that is a time to absolutely get to the nearest emergency room, or depending on the situation, call 911. Stress is, when people are stressed, they're under a lot of pressure, and it's usually when there are a lot of changes. So of course the pandemic, a ton of stress during the pandemic. We all tend to worry about things that are happening in the future, and we obsess over things that we cannot control. We stress when things are uncertain. Certainly the pandemic is an example of that. And we worry when we have too many responsibilities. Also, it's important to note that people get very stressed when they don't have enough to do also.
So, y entonces, el estrés es la sensación de estar abrumada o incapaz de hacer frente a las presiones emocionales. Cuando el estrés se prolonga, el riesgo para nuestra salud física y mental aumenta. Los problemas de salud mental incluyen ansiedad, depresión, abuso de sustancias, problemas de sueño, dolor físico, que a menudo se experimenta como tensión muscular. El estrés también puede conducir a respuestas inflamatorias en el cuerpo que se asocia con problemas de salud crónicos. Un ejemplo de esto se puede ver en nuestra piel. El estrés puede manifestarse como acné o erupción cutáneas con picazón. El estrés disminuye nuestro sistema inmunológico y podemos contraer resfriados y gripes frecuentemente. También puede causar periodos irregulares para mujeres que pueden causar estragos en sus ciclos menstruales. También es importante tener en cuenta que la ideación suicida es una preocupación muy importante. El estrés es causado por sentirse bajo presión y ocurre cuando se producen grandes cambios. Todos tendemos a preocuparnos por las cosas en el futuro y a menudo nos obsesionamos con lo que no podemos controlar. Estamos interesados en tiempos de incertidumbre y nos preocupamos cuando las responsabilidades se sienten demasiado. También es interesante notar que cuando la persona no tiene suficiente que hacer, pueden sentirse estresadas.
Thank you. I will say, Lauren, that I totally relate to these, especially in these times as COVID. Many of these things I've had to relate to with not only myself, but my family. So it's really important. And as we said, as we have been living in such unprecedented times with so much information that has changed out there from day to day, can you explain how the pandemic has made life more stressful for people?
Yeah, absolutely. So I'm going to use statistics from the American Psychological Association, which showed that anger, anxiety, and sadness increased in 84% of Americans during the pandemic. The biggest reasons cited for these negative feelings were employment issues and education school problems. People also highlighted how difficult it was to deal with change. I mean, it's difficult to deal with change in good times, so it was particularly hard now. The other thing that was really noted was how difficult the isolation was during lockdown. We're social beings, and it was very hard to be so distant from our loved ones.
So, entonces, la pregunta es, ¿puede explicar cómo la pandemia ha hecho que la vida sea más estresante para las personas? Y entonces, un estudio realizado por la Asociación Americana de Psicología mostró que la ansiedad y la tristeza y la era han aumentado en más o menos 84% de los americanos. Las razones principales citadas para esto fueron los problemas de empleo y los problemas escolares. La gente destacó lo difícil que fue tener tantos planes cambiados. También enumeraron la soledad requerida durante el confinamiento como una razón de sentimientos negativos.
I will add, Lauren, during the pandemic, which is still going on, my son actually was in college in Massachusetts, and they were all sent home, and all of his friends were sent all over the place, locked down for quite a while with the school, and it really we really had a tough time with it, and it was difficult for him and difficult for us, which leads me into my next question, which is how have parents been uniquely affected during this time?
Okay, so also according to the American Psychological Association, 39% of parents really worried about the academic standing of their kids. They felt they had fallen behind. 36% of parents worried about their children regressing socially and emotionally. Out of everyone, I would say parents probably had the most difficult time because they had to find a balance between their personal life, their work life, and raising their children. So it was a lot on their plates. Parents are always concerned about their kids. I mean, that's part of who we are and what we do. And so it's very understandable that a pandemic would escalate these concerns. Another thing I would say is that parents reported feeling very burnt out, especially during distance learning, because they had to function both as parents and as teachers. And, that wasn't in their plan, of course. COVID threatened their children's well-being, their safety, and their development, and that those problems continue for a lot of people. So I think that sets parents apart from other factions of society.
Mm-hmm. So, la pregunta es, ¿cómo se han visto afectados los padres durante este tiempo? Y el 39% de los padres están preocupados de que sus hijos se hayan quedado atrás académicamente, y el 36% de los padres encuestados por la Asociación Americana de Psicología afirman que están preocupados por el bienestar emocional y social de sus hijos. De todos los padres ha tenido más dificultades para encontrar un equilibrio entre sus vidas personales, sus vidas laborales y la crianza de sus hijos. Los padres se preocupan por sus hijos en el mejor de los casos. Es comprensible que la pandemia intensificará todas las preocupaciones. Puede ser difícil satisfacer las necesidades de nuestros hijos cuando las cosas van bien, por lo que una pandemia mundial empeoró mucho todo. Muchos padres informaron que se quemaron para no funcionar como padres y maestros durante el aprendizaje a distancia. Solo quieren ser padres. El COVID amenazaba el bienestar, la seguridad y el desarrollo de sus hijos. Fue y sigue siendo un problema.
Thank you very much, Lauren. This is actually a question that I especially think is important for not only myself, but other parents out there, is what are some of the signs of stress that parents should look for? And what are the signs that you can tell that children are dealing with stress?
Okay, so I broke this down into physical signs of stress and emotional signs of stress. And the physical signs of stress include headaches and stomach aches, chest pain, heart palpitations, insomnia, nightmares, bedwetting, decreased appetite, or on the other side, stress eating, pretending to be sick to avoid school or other activities. And then the emotional signs of stress would include anxiety and mood swings, restlessness, clinginess, new fears or recurring fears, increased crying, decreased motivation or concentration, particularly with school, overreacting to minor things, regressive behavior like thumb sucking, nail biting, sleeping with stuffed animals, isolating themselves more than necessary, or sometimes kids just become unwilling to do activities that used to bring them joy. Parents have to understand, though, that some small amount of stress is normal, but it's the extreme responses to events that we really have to pay attention to and possibly call the doctor. We have to be sensitive to kids because there was so much disruption in their lives, and they, we need to have sympathy for them because they missed a lot of milestones, which is really sad for them and very sad for us too.
So, y entonces la pregunta es, ¿cuáles son algunos indicadores de estrés que los padres deben tener en cuenta? Además, ¿cuáles son las señales de que los niños están experimentando estrés? Y los signos físicos de estrés incluyen dolores de cabeza, dolores de estómago, dolor en el pecho, palpitaciones de corazón, insomnio, pesadillas, enuresis, disminución de apetito, comer por estrés, fingerse enfermo para evitar la escuela o otras actividades. Y los signos emocionales de estrés son ansiedad, cambios de humor, inquietud, aferramiento, miedos nuevos y recurrentes, aumento de llanto, disminución de la motivación y la concentración, reacciones excesivas a incidentes menores, retroceso hacia comportamientos reconfortantes de la infancia, como chuparse el pulgar y morarse las uñas, dormir con un animal de peluche. Disculpa, I lost my place here. Okay, here we go. Aislamiento social y retraimiento y no está dispuesto a participar en actividades que trajeron alegría a la vez. Los padres deben entender que tener una pequeña cantidad de estrés es normal, pero cuando los hijos tienen respuestas extremas a diferentes eventos, es hora de hablar con un médico.
Lauren, these signs that you were speaking about, if you identify these signs within your children, what would you recommend as the first course of action for this?
Okay. So the goal is not to eliminate all anxiety, but to learn how to manage it. We can't eliminate all our triggers. It would be impossible. And to a certain extent, anxiety and stress exist to keep us alive. I mean, if we didn't have it, and I always use this example, we would walk in front of traffic. I mean, we have to have a level of anxiety for our survival. But kids have to learn how to tolerate it. You don't want your children to avoid things, because then the fear grows and it becomes worse. And we want to avoid the avoidant reaction. But we need to have very realistic expectations for our kids. You want them to feel heard and validated. The example I use is, let's say your child is going ice skating and they're nervous, they might fall. Listen to what they say, validate their concerns, and be realistic. Like, yes, you might fall, but that's not the end of the world. You get up, you keep going, validate, hear them, but you want them to do it. You want them to go forth. You don't want to empower the worries, and you don't want to amplify their concerns. The other thing that we have to be mindful of is you can't ask a leading question. So for example, if your child has a test, you would never say, or you shouldn't say, are you worried about the big test? Because that in and of itself will provoke anxiety. You also don't want to give your children a long anticipatory time to worry about something. A very good example of that is, let's say, going to the doctor, or maybe getting your COVID vaccine. Depending on your child, maybe a day is enough, maybe a few hours, but you don't need more than that because nothing good will come from it. And if you're nervous about something yourself, share it with them. I was nervous about this presentation. I shared that with my son. You know, I'm nervous about this. I'm just going to learn my material, really know it cold, because kids will do what we model, you know, not what we say. It's what we model that really matters. I do want to just add, though, red flags. This is a time to call the doctor when you see things like bedwetting, frequent temper tantrums, separation anxiety that seems extreme, and when you see language regression, like baby talk, that sort of thing. Then I would call the doctor and get an appointment with a therapist. And many pediatricians have them on staff.
So la pregunta es, si identificar estos signos, ¿qué es lo primero que debe hacer? Y el objetivo no es eliminar toda la ansiedad, sino aprender a manejarla. No puede eliminar todas las indicaciones, pero puede enseñar a los niños cómo reaccionar ante ellas. Los niños deben aprender a tolerar algo de ansiedad. Usted no quiere que sus hijos evitan las cosas porque entonces desarrollarán una reacción de evitación. Debe tener expectativas realísticas para sus hijos. Quieres que se sienten escuchados y validados. Por ejemplo, si su hijo va a patinar sobre hielo, es posible que le preocupe caerse. Escucha sus preocupaciones sin preocupaciones. Desea validarlos sin amplificar sus preocupaciones. Si te caes cuando patines sobre hielo, estarás bien. No hagas preguntas principales. Si a un niño se acerca una prueba, no le preguntaría, ¿le preocupa la prueba? No. Les dé a los niños un largo tiempo de anticipación para preocuparse por algo. Por ejemplo, si están preocupados por ir al médico, denles un día o unas horas de advertencia. No necesitas saberlo con una semana de anticipación. Si tú mismo estás nervioso por algo, habla de ello. Los niños necesitan escuchar que ustedes están nerviosos, pero que está manejando su ansiedad. Harán lo que modeles, no lo que digas. Es hora de ver un terapeuta si su hijo exhibe enuresis o rabietas frecuentes, ansiedad por separación hasta el extremo y regresión del lenguaje como habla con el bebé.
I will say, Lauren, that, I have at home a 22-year-old, and you always want to fix everything for them. And I think what you said for myself about validating is so important. And he tells me all the time, he's like, Mom, I just want you to hear me and validate. You can fix it later. So I applaud you on that. I've learned that recently with my own son. It's really important.
I'm still learning.
Yeah, I'll probably continue to still learn. What is the impact of mental health and stress on the overall health of everybody?
Okay. So over time, continued stress on your body will contribute to heart disease, high blood pressure, diabetes, anxiety disorders, depression. Everyone is impacted differently, but these are general ways in which we see stress and how it impacts the body. Women tend to be more open about their stress, but men are absolutely as deeply impacted by it. The goal, and I've said this before, the goal is to take off the table what we can eliminate stress-wise. But for the things that we can't take off the table, we have to develop strategies, coping strategies for, and I have some I can offer. The other thing to remember is that self-care is absolutely not selfish. It is so important. I mean, the example that's always given is the oxygen mask on the plane. You cannot help your child if you can't breathe yourself. You cannot give your child something to drink if you don't have anything in your cup. So it is really important. And people always think, manicures or massages, fine if that's what you want to do, but just taking a quick walk. Studies show that 25 brisk steps outside eliminate a lot of anxiety and can really change the mindset. There are a number of very quick techniques that people can just use to take care of themselves in the moment. I'm not saying it's a long-term strategy, but just to help get through that moment.
So la pregunta es, ¿cuál es el impacto de estrés en la salud en general? Y con el tiempo, la tensión continuar en su cuerpo por estrés puede contribuir a la enfermedad cardíaca y la presión arterial alta, la diabetes y la ansiedad y la depresión. Es importante recordar que el estrés afecta a todos de manera diferente. Las mujeres hablan sobre el estrés más abiertamente, pero también afecta a los hombres. El objetivo debe ser eliminar todo el estrés que se puede y desarrollar estrategias para el estrés que queda. El cuidado personal no es egoísta. So, es muy importante mantener su cuidado personal.
I will say self-care, I've learned that too, and trying to do that, especially with COVID, it really forced me to go out into nature and go for walks, and it just regulates you, just brings even like 20 minutes, 10 minutes, just go for a walk around the neighborhood. It really does a lot. And then you are that better parent or that better friend or that better spouse. It really does help.
Yeah.
Lauren, what are the realistic things or activities that families can do together to decrease their stress and improve their overall health? Specifically things that may not require me or someone else to have to go to a doctor or a clinician.
So I love short sayings because it helps my brain remember things. And one thing to keep in mind is that motion produces better emotion. So walks, hikes, things like that, yoga. And, I put it on the YouTube with my son and we can do it. We find a video that works for both of us and we can do it right here on the ground. Things that allow us to be a little physical. Other things that have been very successful for the clients I've seen have been game nights, movie nights. Looking at old photos has been a really nice thing for families to do together. Crafts like paint it out. That's what we tell kids to do. Different colors, different paint strokes really helps decrease their stress. Flying kites, guided meditation in the same way that people use yoga on YouTube. You can find guided meditations, there are millions of them. The family them together, drinking hot chocolate together, warm drinks. Young kids love snow globes. That's one of the crafts I always suggest. You take a mason jar, some water, some glitter. It's very relaxing for them to do that. Blowing bubbles is a big one. Young kids blowing pinwheels. Adult coloring books has helped so many people as well. And these are activities people can do together. One thing to remember is that, and this is another expression I really like, nothing changes if nothing changes. So if you sense a problem or it's absolutely it's just crucial that you take small actionable steps to correct it, because nothing's going to get better on its own. Another thing I really suggest, and it's sort of an activity for families, but it really helps particularly with kids. When kids are worried about something and it's, really on their minds, you can't tell them, don't worry about it, don't think about it. Because if I said to anyone right now, okay, don't think about apples, I guarantee the only thing in your brain right now is picturing an apple. We can't respond to the negative. So what I like to suggest as a family activity is sometime between after school and going to bed, you sit down and you have a worry jar and you write down your worries. You take, little slabs of paper, and you cut them out and you put them in the jar, and you take them out. And if it's something that's out of your control, you throw it away. You can't deal with things. If it happens, we'll deal with it. But 90% of the things we worry about never even happen. But the things that are in that jar that you can do something about, you take them out and you make a plan. And then as soon as that worry is gone, you get rid of it. And you designate a short period of time for it, like 7 to 7:10. So kids, when they're worried during the day, or you yourself worry during the day, okay, I'm not going to think about that now, but you're not forbidding it, but I am going to designate a time. I will deal with it at 7 p.m. That kind of thing. It has been really successful for people.
Y entonces la pregunta, ¿cuáles son las cosas realistas que las familias pueden hacer juntas? Recomiendo caminatas, yoga, se puede usar la instrucción de YouTube, noche de juegos, película, noche, manualidades. A los niños les gusta pintar su estrés. Mira fotos antiguas, cocina, coma juntos en familia, como una familia, vuelve una cometa, meditación guiada. También se puede usar de YouTube, frascos de preocupaciones. Los niños y los padres tienen un tiempo designado para poner sus preocupaciones en papel y guardarlas en un frasco, y cada noche revisa los papeles y arranque las preocupaciones que ya no existan. Toma bebidas calientes junto. Por ejemplo, caliente chocolate, o chocolate caliente. Hace globos de nieve, agua, purpurina. Niños pequeños como molinetas y burbujas soplando. Libros para colorear para adultos y también para niños. Quiero dejarte con algunos pensamientos si hay tiempo. Mi dicho favorito es: nadie cambia si nadie cambia. Tienes que establecer pequeñas metas y toma pequeñas acciones cada día para lograr estas metas. Las personas se sientan mejor cuando pueden verse a sí mismas progresando. El movimiento produce una mejor emoción, por lo que es importante mantener cierto nivel de actividad cada día. Sentirse estresado casi puede convertirse en un hábito. Las cosas que funcionan para ti. Cuando se siente estresado, chupe un cubo de hielo o camina 25 pasos al aire libre rápidamente. Te te ayudará a mantenerte presente. Permanecer presente combate la ansiedad, ya que la ansiedad casi siempre se trata de preocupaciones futuras.
Thank you so much, Lauren. I think I'm actually going to go home and make one of those snow globes. I absolutely love that idea. I really did. This has been so very helpful and so insightful as well. We really appreciate you being here to speak to all of us on such an important matter that affects all of us. Before we open it up from questions for the audience, we would like to now transition into a fun game of trivia, which I love. So we will go through 5 questions and we ask that you put your answer into the chat box below. The first person to answer the question correctly will receive a special prize. Please note, we would love to limit this to 1 prize per person. But if you win one, we would love you to still participate. Okay, here we go. Please make sure, let's see, here we go. All right. Question 1, which of the following are signs of stress?
¿Cuáles de los siguientes son signos de estrés?
A, muscle tension.
Tensión muscular.
B, trouble sleeping.
Problemas para dormir.
C, trouble staying focused.
Problemas para mantenerse concentrado.
Or D, all of the above.
Todas las anteriores.
We already have one winner immediately. Angelica was our first winner. So Angelica, congratulations. You have just won a gift card to Whole Foods. So congratulations to Angelica.
Felicidades, Angelica.
Okay.
Thank you so much.
You're welcome. All right, folks, we're on to question 2. What activities should I do to try and de-stress?
¿Qué actividades debo hacer para eliminar el estrés?
Eat a healthy meal.
Come una comida abundante.
Meditation and physical activity.
Meditación y actividad física.
Stay home and do absolutely nothing.
Quédate en tu casa y no hagas nada.
Or D, all of the above.
Todos los anteriores.
Okay, well, we have Angelica came in, but we know she's already won one, so congratulations. But Patricia also answered correctly. So Patricia, you are our next winner and you receive a gift card to Dave's Marketplace. So congratulations to Patricia.
Felicidades, Patricia.
Okay. Here we go. Question 3, true or false? My diet and physical activity can impact how stress affects my health. True or false?
Okay, mi dieta y actividad física pueden afectar la forma en que el estrés afecta a mi salud. ¿Verdadero o falso?
All right. Cassandra, you won. You are a winner and you actually also receive a gift card to Dave's Marketplace. Okay. Question 4, true or false? It is important to remember that everyone goes through stress, so we should be open and help each other get through it.
Es importante recordar que todo el mundo pasa por estrés, por lo que debemos estar abiertas y ayudarnos unos a otros a superarlo.
Okay. So now we're gonna, I think all of you have answered correctly. So now we're gonna get double gift certificates to everybody. Patricia, you actually have won again. The answer is true. And you are receiving a gift card to Target. So congratulations. Okay, here is our last question. True or false? I am more likely to live a longer, healthier life if I eat nutritious diet, exercise to my best ability daily, and focus on my mental health.
Es más probable que tenga una vida más larga y saludable si sigo una dieta nutritiva, hago ejercicio al máximo de mi capacidad todos los días y me concentro en mi salud mental.
We have Rita. Congratulations, Rita. Rita was the first to answer that, and she receives a gift card to Target. So huge congratulations to all of you. Thank you very, very much. Thank you so much to everyone for playing. My colleague, Andrea Turtletab, will be in touch with our winners to coordinate receiving your prizes. And let's see, I would now like to welcome Lauren back as we open it up to the audience for some questions. Please feel free to type in your questions in the chat or take yourself off of mute to ask your questions out loud. Anybody have any?
Yes. Hi. Nice to meet you. My name is Angelica Gonzalez. So isn't it really important to know that information to bring, because that happened to me right now with my old baby. So I'm going to explain my case and share with you. And if you can help me a little bit, how to can handle it. I spent all the entire pandemic with 2 pregnancies. I get pregnant twice in the entire pandemic era, if we can say. The experience with my first pregnancy was a little bit high and lows, emotional things, because was the first pregnant, my first baby, and also come everything together, all the country, the world, not only the country, the world is coming shut down, and is that give me a lot of anxious, feel angry, and also fight with my partner also. After the delivery, I get my baby to try the best I can and try to walk out and do kind of exactly you're explaining, walk out, to do some stuff outside. But my baby right now, the other ones, he's in a really strong personality. So he's screaming all the time. He doesn't like to go to the grocery store. We can hang out with him to the Target store or to the mall, because he started screaming. He don't want to do nothing. He wanted to be on hands. It's a really big nightmare. But when we go out to the park, walking around, he feels like free. I don't know if it's spent all the time into the walls, change his attitude out of the walls. And so I don't know if I was explaining, because when we go out to the park to outdoors activity is happy. But if we go into a mall, oh my God, my husband and I said, you know what, pick up everything, let's go. We can spend more than an hour in the mall or in a store, because he starts anxious, scream, he dropped everything. So I don't know. I'm trying to focus to do the best we can, but sometimes no. No, we raise our hands and say, give up, let's go. So I don't know if this situation help a little bit, or I don't know.
How old is your son?
1.5 years, 18
Okay.
months.
18 months. One thing that has been very helpful with young kids, put his hand in front of him like this, and each finger pretend is a birthday candle. breathe in through the nose, hold it, out through the mouth, and blow out each candle. It will relax him immediately.
Okay.
Okay, that helps a lot. Does he suck on lollipops?
I've tried. He don't
Okay.
eat nothing of candy because I'm not, you know,
Okay.
we
Okay.
get a really diet.
Okay.
balanced diet.
Okay.
No candies.
Okay. The other thing is, and this is a little harder if you're out, but if he has a meltdown at home, what happens when people have meltdowns, usually they're extremely anxious. So if he's allowed to, if there's a way to safely have him suck on a piece of ice or an ice chip, whatever you're comfortable with, that's something that keeps people very present. You can't really think about anything else but the present moment when you have an ice cube in your mouth. That's the goal, to get him present so he's not worrying about what happened in the past or what's going to happen in the future. You want to keep him present and then set up what's going to happen next. Small steps.
Okay. Awesome.
You know? Okay,
Thank you.
sure.
Thank you. Does anyone else have any questions? You can take yourself off mute and ask. You can put it in the chat.
Can I say one thing?
Sure.
Oh, okay. One thing to keep in mind, and maybe everybody can do this at home. One thing to keep in mind is that everything we feel, it's our thoughts produce an emotion, which then produce an action. And what we want to do is sort of, first thing, we want to recognize how important our thoughts are. So if everybody right now, this takes 2 seconds, if you close your eyes, and I'll do it too, and you put out your hand and pretend I'm putting a lemon in it. Okay, and once you can feel that lemon, it takes some imagination, really bring it to your nose and really smell that lemon. Really smell it. And when you're ready and you think you really have a sense of what the lemon smells like, take a bite of it and tell me what happens to your mouth. When you really can, you know, it feels like you have a lemon. Yes, your mouth starts to water. Exactly. Now, what was there? It was air. There was no lemon. I use that activity, particularly kids, but sometimes adults, just to show how powerful our thoughts are. So it really matters how we think about things. It's important to see things how they are. It's very easy for all of us, and I am no exception, to always see things as worse than they are. So we want to teach ourselves and our kids to see things as they are and to understand and recognize the power that our thoughts have.
And I'll add on to that, Lauren. I agree with you, and I try to work on this every single day. Is that and the creating scenarios, or what if this happens, or what if that happens, or
Yeah,
I
have to climb off. I tell everyone, climb off that what if tree.
Yes, I need to do that.
I do too. We all do.
Yes, I do it. I'm doing better, but I still need some work. I'm still a little rusty. So I think that's really, really important. Does anyone else? Yeah, go ahead, Laura.
One other really quick tip, because it's helped so many people, and I've actually put myself out of business a few times with it. So I love this trick. If you know, like I will use myself as an example. If you have a known trigger, like for me, there was a section by the mall on 95 that just invoked anxiety in me, and I don't want to avoid things. So if you have a known trigger and you can chew gum, or if you can't chew gum, you can suck on a mint, whatever, put that in your mouth, because our brains cannot decipher a perceived emergency from a real emergency. So once you're chewing that piece of gum, your mouth is watering, you're having normal bodily functions, your saliva's there, you're chewing, your brain knows, okay, wait a minute, we're not in a real emergency. A bear is not chasing us. It immediately brings you down. You cannot go into panic mode. So it's a really helpful tip.
Wow. I'm gonna get some gum on the way home. That's extremely helpful.
Yeah.
And I have to thank you, Lauren, especially. I'm thrilled to be here at the American Heart Association, but last year I actually, besides my son being sent home, I actually lost my job during COVID, and just that that mental stress and those what ifs and how am I going to pay my bills, and it can really get the best of you. So all of these tips, parents, children, grown children, everybody, it's really, really helpful. I'm just really happy that you were here to speak to all of us today. So thank you very, very much.
Thank you.
I don't want to go too much if anybody has any other questions. Okay.
Just
Thank
wanted
you.
to make a comment. Sorry, Carla.
No, go
I
ahead.
just wanted to say that sometimes, like, being able to get your thoughts from here on paper. So like writing stuff down. If I'm worried, writing everything that I'm worried about. If I'm angry, writing out what I'm angry about. And if you have a child that's old enough to be able to do that as well, sometimes it helps just to get it out of here, because much going on in your brain, that get it on paper, get it out, whether you want to crush it and throw it away, or you want to just keep writing every day or every time you feel like you need to.
Absolutely.
Absolutely.
Can I translate that? Because I think that that's, a really
absolutely.
point here. So una estrategia para su estrés, o cuando estás enojado o tiene anger, es muy importante una estrategia para escribir cuál es el problema, por qué está enojado, y una práctica para ustedes y también sus hijos. Y más o menos para eliminar el estrés.
I would also like to thank Albert for his incredible translation today. Thank you so much, Albert. And I would now like to thank Neighborhood Health Plan once again for their generous support that has allowed us to all convene here today. To say a few words about Neighborhood, please welcome Rosemary O'Brien, who is Health and Wellness Specialist from Neighborhood Health Plan of Rhode Island, to speak about Neighborhood Health Plan. Rosemary?
Hi, everybody. I want to thank American Heart Association. Thank you, Albert, for translating. That's such an important thing. I want to thank CCF for collaborating with us. Lauren, thank you so much for all your good advice and suggestions. If you know anything about Neighborhood Health Plan, we're a health plan. We have Medicaid patients. We have commercial, which are people that purchase insurance. And basically our goal is to help all Rhode Islanders have access to healthcare and to get insurance if they are able to get insurance. So that's some of the things. And if you are a neighborhood member, you do have what they call a behavioral health service. So you can see a therapist like Lauren, you can go to counseling, you can, have that experience if you think that that's something that would help you in your child. And Angelica, I was thinking about your son and the mall. So yeah. I was thinking about, those fidget spinners, do you remember? They were like a big craze at one point. It's a little disc like this, but it's got all these little pieces that come around.
Oh, gotcha. Yes.
Spin it.
Yeah.
Yes.
So I'm just wondering to myself if that is a special toy that you keep aside, and he could take that when you go to the mall. So it's like he's got something to sort of, keep himself occupied, and maybe that he enjoys. Yeah. That's our special go to the supermarket or go to the mall toy.
Right.
About. But I want to thank everybody who attended tonight too, because I know everybody's life is crazy and busy, and I so appreciate you taking time out to hang with us and get some good ideas about how to handle stress. So thanks.
Entonces, dice gracias a todos, especialmente a Lauren and the CCF y the American Heart Association. Y también hay información sobre seguros de salud with Neighborhood Health Rhode Island, Health Plan Rhode Island. Y también hay servicios para salud mental. Y entonces, si ustedes necesitan ver o visitar una, ¿cómo se dice? Puede ser doctor o una profesional de mental,
Mhm.
ellos tienen este servicio también. So, hay muchos servicios que ellos tienen para salud física y también para salud mental.
Thank you so much, Rosemary, and thank you again to Neighborhood Health Plan of Rhode Island for making this program possible. Thank you so much, Lauren. Thank you so much, Beth. I would like to thank all of you again for taking time to join with us here tonight. Our health well-being is so important, and you are all taking the necessary steps to help you and your families live longer and healthier lives. My colleague Andrea and I will be in touch via email with everyone registered here with an overview of these tips and some heart-healthy recipes for you to incorporate into your diet.
Awesome.
Entonces, gracias a todos y también nosotros para recibir más información sobre cosas para hacer o mantener su salud como recetas o otras cosas materiales o información desde the American Heart Association. So, muchísimas gracias por todo.
Thank you.
Have a great
for
night,
running the show.
everybody.
Gracias.
Gracias.
Thank you. Have a good
Gracias.
night.
Gracias,
healthy.
gracias. Have a
Bye.
wonderful
Good night,
night.
everyone.
Thank
Have a good
you.
night.
Night.
Thank you. Good night.
Bye, everyone. Good
Good
night.
night. Thank you, Rita.